Well, hello, and welcome to Module 3. In the first two modules, we reviewed the basics of pharmacology and the nurse's role in administering medications. Now, beginning in Module 3, we will start talking about different classifications of medications and some individual drugs within each of those classifications. Remember, there are hundreds of drugs in your chapters and in the world. We do not expect you to memorize every drug, nor do you have to. You want to study the drugs in their classifications. So what is similar about them? And then we have some prototype drugs or drugs that are on your need-to-know medication list. So you want to make sure that you are looking at the details of those and what is unique about those individual drugs and why are they different from the different classifications. So in this module, we will begin to discuss anti-inflammatory medications. This includes aspirin, NSAIDs like ibuprofen, and acetaminophen. Now, acetaminophen or Tylenol is not an anti-inflammatory medication, but we study it during this module because it does some of the same things as the anti-inflammatory medications do, right? They treat fever, pain, so we study them along with the anti-inflammatory medications. Also, we will be studying in this module anti-neoplastic drugs, and these are drugs that treat cancer. Sometimes people refer to them as chemotherapeutic medications, but we will be studying the general concepts of anti-neoplastic medications. You will not be expected to know the individual or unique characteristics of each of the chemotherapeutic medications. Remember, in order to understand these different drugs and the nursing care that goes with them, you will need to refresh your memory about normal physiology. So depending on how well you did in physiology or how long it's been since you took physiology, you may need to spend a little bit more time on chapters 7 and 15. Most of your exam questions are not going to be what's happening in the tiny little cellular level. Most of those questions are going to be on your pathophysiology exams, although you will have some questions on just normal physiology because medications are going to mimic the normal physiologic processes. But most of your questions are going to be nursing application questions. So if a nurse has this patient, what is the nurse going to have to look out for when caring for this patient? What are the topics that the nurse will have to educate the patient on, and so forth. In this module, you will be learning how medications work on receptors to cause physiologic responses. You will learn how to provide nursing care to patients who are taking anti-inflammatory drugs and anti-neoplastic drugs. That includes what data needs to be collected before you administer the medications, what the nurse needs to look out for after administering the medications, what adverse events to look out for, and what to teach the patient about these medications. Lastly, be sure to utilize all the resources within the modules, including watching the videos. Have a great week.